In today's topic, Columbus, multiple sclerosis, or MS for short, millions around the world are affected by this disease that scientists to this day do not completely understand.
The slow breakdown of the body's communication network, MS is a disease where the body is tricked into attacking itself.
The immune response cells in the body's nervous system respond to what they believe is an infection, when in reality the disease, MS, is telling them to attack parts of the insulation that keeps our nerves relaying messages effectively.
Slowly over time, the insulation to the nerves in the brain deteriorates to a level where they become bad at carrying signals along, causing fatigue, headaches, a lack of coordination, and other terrible side effects.
With disease affecting people of northern United States and southern Canada more than any other area in the world, pressure grows on the medical community to tell us what's happening and how to cure the disease. We now tune in with our reporter, Miss Bailey, with an interview with somebody with multiple sclerosis.
Hello, we're here today with Yvonne.
Hi, how are you?
Yvonne is affected by MS. He's going to discuss with us his symptoms, flare-ups, and what daily life is like for him. Yvonne, thank you for being with us here today. Can you describe a day for you?
Hi, well, I'm glad to be here today. Normal day consists of me waking up, getting ready, like showering, using the restroom, brushing teeth, changing, maybe make a meal or not, head on to work, come back, sleep.
So it sounds like a typical day, like anybody else would have.
Yeah, it's basically a typical day, nothing too crazy or out of the ordinary.
Okay. And what about a flare-up day? What does that look like for you?
So when I would have flare-ups, I'd be pretty tired. You can literally say fatigued. I don't want to get up. Everything's a hassle to get done. Not only that, parts of my body are numb, so it's kind of hard to grasp things when you can't really move your hands or at least feel your hands moving. Typical pains and aches. More like having a body-style migraine compared to having a regular migraine. I know those would be pretty painful. But yeah, just besides just the whole discomfort and pain, you can still kind of manage around. It's not too bad, but it's a bit of a discomfort.
Right. And MS is very unpredictable. So how does that affect your job, and how does that affect your personal relationships?
Well, luckily for me, at work, it's something that I can just talk to my manager about. So I can have them put me on tasks that are a lot easier to control, so no heavy lifting, nothing to do with high temperatures. Just friends, I'll be way too tired to go out and spend time. A few of us love to go out for drinks or just for a casual movie or something, but I'll just be way too tired, or I'll be in pain. And it's one of those moments where you're just you don't even want to wake up because you know it's going to be bad, even though there's nothing really bad but the pain and the numbness.
So, what would you like for people to know about MS?
Well, if you see me right now, sitting here talking to you, nothing too crazy. I'm not in a wheelchair. I'm not, dying. I'm just in pain and discomfort. And if you have MS, you can live practically like a normal human being. You just gotta have some treatment, some medications to help along with lowering the pain, and just not think of us as
Subhuman.
Yeah, we're subhuman. We're practically normal. We're just in a lot more pain than you can see.
Okay, well, thank you, Yvonne, for being with us here today.
Thank you for having me.
All right, and we're going to go to a segment with Dr. Deanna Maas. She is a specialist on MS. Thank you, guys.
Nerve impulses with patients with multiple sclerosis are slowly weakened due to myelin sheaths being destroyed. There are many symptoms that show the onset of MS. Such symptoms include numbness and tingling, weakness, abnormal gait, bowel and bladder issues, vision issues, depression, and many others. Women and Caucasian people are most at risk for multiple sclerosis. However, the cause of MS is not fully known and is still being researched today. Multiple sclerosis is prevalent in North American lives more than anywhere else. More drugs and medications are currently being tested that may help those with MS. And although MS does get progressively worse, people with multiple sclerosis are able to live a fairly normal life. The life expectancy of those with MS is only 7 years shorter than those without. Although the disease is prevalent in the United States, being aware of symptoms could help with an early diagnosis. However, the disease is not particularly harmful, and with the right treatment can lead to a pretty much normal life.